We're trying to move the referral patterns for ventricular tachycardia in the setting of patients who had a prior heart attack earlier in the course of their chronicity with ventricular tachycardia, and presumably before they've had all these years and years of exposure to escalating drug doses and repetitive ICD shocks. This trial is enrolling presently. It will be comparing patients who've had just a few ICD therapies. So everyone in the study will have healed heart attacks, a defibrillator implanted for guideline-directed indications, and 1 to 3 episodes of ventricular tachycardia, ventricular fibrillation in the last 6 months. So very early in their journey through the spectrum of ventricular tachycardia. They'll be randomized to catheter ablation versus our best antiarrhythmic drug therapy, which is amiodarone. With, in addition to recurrent ventricular tachycardia, we're going to be looking at kind of more pertinent endpoints such as hospitalization for heart failure and mortality. The trial is not really properly structured to understand the effect on mortality. We really look at it as a step along the continuum. This trial, if it works out the way that certainly I expect it will, that ablation saves some of the morbidity and mortality as opposed to continuing drug therapy and continuing ICD shocks. We'll kind of look at it as a pilot study to do a mortality-based trial.